Hi, I am Dr. Arun Gautam, consultant pediatrician and neonatologist in Cloudnine Hospital, Gomti Nagar branch, Lucknow. Genital care of newborns is also important along with the complete hygiene and basic cleaning of the baby. For the girls, we usually recommend when you clean the baby's potty, clean it from front to the backward to avoid any urinary tract infection. Because if you do otherwise from back to front side, fecal contamination may be around the urethral opening and can lead to the urinary tract infection. So to avoid this, wipe from front to backward. Do not apply any application cream to the genital areas because it can cause irritation. Gently clean the area with lukewarm water and pat it dry. In the female babies, sometimes there may be some vaginal, bloodish or whitish discharge in the first few days or in the first week of life. It is completely normal. If it is persists, then you contact your pediatrician or baby doctor to discuss it further. Do not apply anything to remove these discharges. For the boys, gently clean the penile area and scrotum with the lukewarm water. It's not necessary to retract the foreskin to clean the glans area. As the baby will grow, the foreskin will itself retract and there is no need to pull and manipulate it unnecessary. Gently tap the area. Do not apply any powder or cream to the genital areas. For both the male and female babies, keep babies diaper free time. It can prevent the formation of diaper rash. If baby develop diaper rash, then apply some emollient or simple coconut oil to soothe the irritation. Always try to change diaper frequently to avoid any unnecessary wetness and irritation to the genital area.